You sit down and your butt hurts, or after sitting for long you have now stood up and your butt is paining, or you have been told this is tailbone pain. Today we'll be talking about this. Hi everyone, my name is Dr. Manan Vora. I am an orthopedic surgeon and a sports medicine doctor, and I help you live your life pain-free. Today we'll be talking about tailbone pain. I'm going to tell you what it is, what are the various causes why you may be suffering from tailbone pain. I'm also going to give you a few options that you can try yourself to make sure you get some relief, and when it is important to see a doctor. Let's start. Now firstly you need to understand where the tailbone is. So we have our spine anatomy here for you. You have cervical vertebrae, you have dorsal vertebrae, you have lumbar vertebrae, then you have your sacrum, and at the base of the sacrum is your coccyx or your tailbone. When this area gets irritated and inflamed, you have tailbone pain, and it is clinically diagnosed as coccydynia or coccydynia. Now usually patients complain that they have a dull aching kind of pain throughout the day, but especially when they sit for long, or after sitting they just stand up or they bend forward, they experience a sharp shooting like pain. Some patients also say that the pain gets aggravated and increases after using the toilet, or if they are sitting for a long duration of time, or for women even after or during menstruation. Now why do you get coccydynia or coccydynia? You can have it due to an acute issue or a chronic issue. Now acute means you've had a fall on your tailbone and you've injured that area, or it has irritated or inflamed the tissue around your tailbone. However, most cases are seen in a chronic point of view. Here are the chronic causes. The first one is long periods of sitting. Sitting for extended duration of time, commonly on hard surfaces, puts a lot of pressure on your tailbone, leading to tailbone pain. This is extremely common in patients who have a desk job. The second one is poor sitting posture. If you are slouching or leaning far back too much, it puts undue pressure on your tailbone. Over time, this leads to discomfort and soreness. The third one is weight issues. If you are overweight, it leads to more pressure on your tailbone. If you are underweight, it leads to less cushioning around the bone. Both of these scenarios can lead to tailbone pain. The fourth point is pregnancy and childbirth. The growing baby puts pressure on the tailbone during pregnancy, and some women even complain of tailbone pain after their delivery due to the strain on the tailbone. The fifth point is arthritis. Arthritis in the joints can affect various areas in the body, and the tailbone is no exception, making movement extremely uncomfortable. And the sixth point is unknown causes. In some cases, we don't have a clear reason as to why this tailbone is painful or inflamed or irritated. We call this idiopathic tailbone pain. Now let's talk about some simple solutions that you can try. The first one is trying out a coccyx cushion or an air pillow ring. It's basically a pillow with a cutout, or it's donut shaped. What this does is it relieves the pressure on your tailbone, making it comfortable for you to sit for a longer duration. Some people also find sitting on an exercise ball very helpful, at least for short durations of time. The second point is correcting your posture. Learn to sit up straight, because if you slouch or lean back too much, you will put strain on your tailbone, leading to tailbone pain. So fix that posture. The third point is alternate ice and heat therapy. Take some ice, wrap it in a towel and place it on your tailbone for 15 minutes. Once that is done, the swelling will start reducing slowly. You can apply a heating pad to relax the area. Try this alternate ice and heat therapy 2 to 3 times a day for at least 3 days to see some benefit. The next point is wear looser clothing. Tightly fitting clothes like skinny jeans can also increase the pressure around the tailbone. Wearing looser clothes around the lower back area can also help you. The next point is practice pelvic floor exercises with an exercise therapist or someone who is specialized in exercise therapy. What they will do is actually strengthen the area around the pelvis, which is near the tailbone, and ensure that the pain settles down along with the inflammation. These exercises are also extremely helpful during and after pregnancy. And the last point is over-the-counter pain medication or anti-inflammatory medication. Don't self-prescribe. Get checked by a doctor who will put you on anti-inflammatory medication, and this really helps in reducing the swelling and actually giving you some relief from this tailbone pain. Now, when to see a doctor if your tailbone pain is not improving after a week or two, or you have tried some of these options that I mentioned and you are not getting relief. It's time to get checked by your orthopedic doctor, who will reach a proper diagnosis and give you alternate management solutions as well. The first solution will be to create a customized exercise program for you to help relax the muscles and then strengthen the muscles and ligaments around the tailbone. The second option is injections for pain relief. We have a variety of options over here. Whether it is injecting a local anesthetic or even a steroid injection, you could even consider a PRP injection for tailbone pain, and in some cases a ganglion impar block is also considered to take away the pain sensation that tells your brain that your tailbone is painful. And the last option is surgery. This is rarely done for a tailbone issue, but if there is no other cure that we can find, then removing a part of the tailbone might be an option. And that's it. You now know almost everything about tailbone pain. If you like this video, please do hit the like button, please do subscribe to the channel, and if you want me to make an entire video about the exercises that you need to do for tailbone pain, drop the comment exercises down below and I'll see you in the next video.